Greetings from Team Digital IMA. I'm Dr. K.K. Agarwal, Honorary Secretary General, Indian Medical Association. Welcome to our weekly show every Thursday where we interact with one personality. Today being a World Health Day, we are going to talk about a new subject. In few moments, our guest faculty, Dr. Sanjiv Chopra, who is a former Dean of Harvard School at Boston, will be joining us. With me at the moment, we have Dr. V.K. Monga and Dr. R.N. Tandon, our Dean of IMA CGP and our Finance Secretary of Indian Medical Association. This program every Thursday is brought to you on IMA website and emedinexus.com website by Digital IMA, an initiative of Indian Medical Association, and Liberate, a patient-doctor relationship platform where doctors can give a consultation online. And now NEHA is coming, the National E-Health Authority of India, which is going to come out with guidelines regarding online consultation, which means now even Government of India is going to allow officially online consultations. Today the topic is diabetes, beat the diabetes, which is a WHO theme. So let's talk a little bit about diabetes. Anything you want to ask, till Sanjeev takes over.
Okay, the issue is today is WHO Day, World Health Day, and Indian Medical Association has taken a pledge to celebrate all over the country within a week and do many activities, be it scientific or cultural or educative programs all over the country. What is the theme of WHO this year?
See, if I want to talk about diabetes, diabetes is basically of three types. Type 1 diabetes, which is where the insulin doesn't work, insulin is not available. When insulin is not available, you are dependent on insulin. Second is type 2 diabetes, which is the conventional diabetes, which we see every day. I myself call it as a lifestyle diabetes. Therefore, lifestyle diabetes can be prevented, can be reversed, can be controlled. There is also a third diabetes called LADA, late adult onset diabetes, which behaves like type 1 but is type 2. That means a person will start with type 2 diabetes and within 5 years all medicines will fail and he will end up into insulin.
Sure.
Okay. So if I take away type 1 and LADA, the commonest diabetes is type 2, which is lifestyle diabetes. A lifestyle diabetes, it is possible to reverse it. It is possible to prevent it. And that's an epidemic. And that's what we are talking about. Now, if I have to give one answer, one slogan for my doctors, and if that is adopted, is that all doctors should keep a measuring tape with them. पेट की चौड़ाई नापो. Keep it 90 centimeter in men and 80 centimeter in women. Okay? It confuses. Then how much fasting sugar should be kept? We know that a fasting sugar of more than 80 or 90 is linked with microvascular disease, microvascular complications like retinopathy, nephropathy, neuropathy. And microvascular disease can be present even at the time of diagnosis because they start much earlier. So my slogan is only one: measure your abdominal circumference
and keep your sugar below that.
And same amount, keep your sugar below that. And then go on reducing your abdominal circumference, your target for sugar will also reduce. Suppose your abdominal circumference today is 100. So target your sugar less than 100. You will prevent diabetes. Now your abdominal circumference become 90. So target your sugar less than 90.
Correct.
So whatever is your abdominal circumference should be your fasting sugar. If you do that, you will be able to prevent microvascular complications. Now if you see Lord Ganesha and Kuber, only two people had pot belly obesity but they did not have diabetes. Why? Tandon sir.
The diet.
The
diet must be different.
And they never had, both of them never had diabetes. Now I'll read out a, have you come? Come. So we have Dr. Sanjiv Chopra, the former Dean Harvard. He is joining us here. Please come here. Please. We are already on the air. So before we take up with Sanjiv on the subject, let me answer him back. Why Lord Ganesha had pot belly obesity, Sanjiv? Lord Ganesha had pot belly obesity.
Yeah.
Kuber had pot belly obesity. Lord Kuber. But they never had diabetes. Okay. The answer comes in Ganesha's prayer. Gajananam bhoot ganadi sevitam. Kapith jambu falsara bhakshitam. Uma sutam shok vinash karnam. Namami Vigneshwara pada pankajam. He says, Gajananam bhoot ganadi sevitam. हम उस गणेश को गजानन के गणेश को नमस्कार करते हैं और गणादि सेवितम जो गणेश की जो ऑफरिंग्स हैं जो गणेश की ऑफरिंग्स हैं उसको खिलाते हैं क्या खिलाते हैं कपित जम्बू जम्बू इज जामुन कपित इज केत फल फलसारा भक्तिनम इनके फल का सेवन करना तो 4 चीज़ें कह रहे हैं कि गणेश जी सेवन करते थे बेल के पत्ते देन केत फल और जामुन के फल तीनों के तीनों एंटी डायबिटिक हैं इफ यू गो टू द आयुर्वेदिक टेक्स्ट ऑल 3 ऑफ देम हैव एंटी उमा सूतम शोक विनाश करनम उमा मीन्स मीठा सूतम मीन्स मीठे से पैदा होने वाली शोक मीन्स बीमारियां विनाश करनम इनका विनाश होगा इन चीज़ों को करने से सो व्हाट दे हैव डिस्क्राइब्ड इज इन दिस प्रेयर दैट इफ यू फॉलो गणेशा's principles whatever he is eating then pot belly will not affect you. You will not develop insulin resistance. And all these 3 drugs in Ayurveda have anti-insulin properties.
Yeah. Very good.
So the whole thing is like that.
Yeah.
So Sanjiv is with us and I have known him for more than 30 years now. 30 years now and I worked with his father. He was my boss, more like my father. And Sanjiv is a former dean of Harvard faculty at Harvard and he's a wonderful teacher. And he was visiting Delhi and I spoke to him and what's new? And everywhere he says people are talking about microbiome. And we went to the Ayurveda, they are talking about microbiome. Modern medicine is talking about microbiome. All India Institute is talking about microbiome. People have started thinking of organizing a full conference on microbiome. Let's understand what microbiome is. And what we are doing at this moment is we have a membership of 2 lakh doctors. This is a live webcast which is coming on IMA website. On an average 1500 to 2000 doctors every week, Thursday 3 to 4 p.m. They get hooked to it. This will also stay on our YouTube and this will also go to the link tomorrow again will go to the people. If you have not watched, watch it.
Okay.
All
Great.
yours.
Great. So I met KK about 2 days ago and he said, what's new in medicine? And I said, the hottest topic in medicine right now is microbiome. And I actually sat down about 2 years ago and it took me about 6 months and I prepared a talk and it's called Microbiome, Man and Medicine. And I've been giving this talk around the country in the United States. In the last 18 months, probably gave it to 30,000 individuals, 30,000 doctors in aggregate. And as a visiting professor, when I've gone to UCLA recently, at the end of the 3-day visiting professorship, met with the chief of gastroenterology. And he said, Sanjiv, give us some advice. What can we do here at UCLA in our GI division? And I said, you should start a center. And you should call it Microbiome, Medicine and Man. Gastroenterologists should take the lead, but involve rheumatology, endocrinology, nutrition, the diabetes experts, the neurologists, the pulmonologists, because it has implications in all of medicine. So what is the microbiome? The concept of the microbiome was first suggested by a Nobel laureate, Joshua Lederberg. He actually got the Nobel Prize in Medicine or Physiology for his work on bacterial genetics. And then about just some 15, 16 years ago, he coined this term, microbiome. He said the microbiome signifies the ecological community of commensal, symbiotic and pathogenic microorganisms that literally share our internal body space. So we have trillions of bacteria in our GI tract, and that's the gut microbiome. It accounts in weight for about 3 pounds. All this bacterial material, it accounts for about 3 pounds in weight. And it's been called the second human genome. It's been called the bacterial inner rainforest. Inner rainforest full of bacteria. The Economist had a cover story some years ago, and it was entitled, "Microbes Maketh Man." So we've had this relationship for centuries between the microorganisms in our GI tract, but also in other cavities, but predominantly in the GI tract. And if you look at the evolutionary timeline, mammals arose about 200 million years ago. Primates on the Earth 60 million years ago. The genus Homo, which includes human beings, about 2.5 million years ago. Microbes appeared 3.5 billion years ago. And they're very dominant. When we are born, the GI tract is sterile. There are no bacteria when we are born as newborns. But within the first few hours, the GI tract gets colonized by bacteria. And then the microbial flora are established in the next month, in the next 3 or 4 weeks. And more than 1,000 species of microbes take up residence in our GI tract. So what shapes our microbiome? It's turning out that pretty much everything, the way we are born, whether it's vaginal delivery or C-section, makes a difference. Where we are born. Are you born in Delhi, Pune, Mumbai, or in a small village? Are you born in Boston, New York, or in a small farm in Iowa? You have a different microbiome. Did you get antibiotics in the first 6 months of your life? That has a huge impact on the microbiome, but also our proclivity to develop certain diseases like asthma. So asthma is more common in developed countries. And in developed countries, it is more common in urban compared to rural. You know, we see kids playing in the dirt, and we'll often say, don't put that stuff in your mouth. Actually, I told my daughter when our granddaughters were playing, picking up stuff and putting in the mouth, I said, let them do it. This is called the dirt hypothesis or the hygiene hypothesis. And you see much less autoimmune disease, whether it's asthma, rheumatoid arthritis, lupus, Crohn's disease, ulcerative colitis in developing countries where there's enough of dirt and bacteria and germs. Travel influences the microbiome. Jet lag can influence the microbiome. If you take a proton pump inhibitor, which millions of our patients are taking for reflux, it influences the microbiome. Exercise influences the microbiome. What we eat. If you eat a vegetarian diet, microbiome changes. If you eat vegan, it changes. If you eat fermented foods, this would be wonderful to check in our ancient Ayurvedic wisdom. So there are studies now looking at kimchi, which is a Korean dish with cabbage and spicy, and it gets fermented, changes the microbiome. So lots of things change the microbiome. So the question is, are these bacteria, friend or are they foe? And they're both. A lot of pandemics over the years have been due to bacteria. Millions of people died from typhus and typhoid and the plague. But right now, with our understanding of the microbiome, we can put it to good use. We can start thinking of therapeutic applications. So now we all know that in pregnancy, people gain a lot of weight. And then at the end of pregnancy, a lot of people have difficulty losing that weight. right? If you check the microbiome in the first trimester, it is totally different than in the third trimester. If you take the stool of a pregnant woman in the first trimester and give it to a lean mouse, it remains lean. If you take the stool from the same woman now in the third trimester, mix it with the food of the mouse gains a ton of weight and develops insulin resistance. So that offers us some insight into obesity and the role of the microbiome, and I'll come back to that. So it turns out most physicians, especially pediatricians, are aware of an entity called necrotizing enterocolitis, right? So there was a study recently of 1,000 premature newborns, and up to 6% of them developed this potentially lethal disease, necrotizing enterocolitis. 35% mortality. And once you develop this disease, you can try antibiotics and all of that, and it doesn't seem to make a difference. So what these authors did was a very interesting study. And what they did was that they showed that premature newborns who survive the first 2 weeks have a much higher risk of dying from necrotizing enterocolitis. The gut microbiota in these newborns are very different. They have much more of gram-negative bacteria and less of anaerobes. But this dysbiosis occurs several weeks before the clinical manifestation of necrotizing enterocolitis. Insight into this offers us a window. Maybe in the very near future, we'll take premature newborns, say they're at risk of developing necrotizing enterocolitis, 35% mortality. Let's check the stool. You start to see the changes. At that point, you intervene before they develop the clinical syndrome. And the intervention would be either antibiotics or probiotics containing the good bacteria. So fascinating. This is very early. What about obesity? So obesity is associated with changes in the intestinal microbacteria. The obese microbiome is much more efficient in harvesting energy from the diet. And it can serve as an early diagnostic marker for the development of type 2 diabetes. Again, we can intervene. So we say this person is destined to develop very high chance of type 2 diabetes based on just studying the stool and the microbiome. Now we can intervene. Should we use metformin? Should we encourage them to exercise? Should they drink coffee? Lowers the risk of type 2 diabetes. So wonderful insight there. When people have bariatric surgery for morbid obesity, it immediately affects the microbiome composition. E. coli, Klebsiella, Pseudomonas become more common. You take the stool from a gastric bypass patient and transform to a germ-free mice. The mice have improved fat oxidation. Okay, so diets modulate the gut microbiome. They improve insulin sensitivity. Arthritis. Roughly 300,000 kids in the United States develop some form of arthritis. Juvenile rheumatoid arthritis being a common one. Kids exposed to antibiotics early in childhood have a higher risk of developing juvenile rheumatoid arthritis. Again, change in the microbiome. And the risk is highest when exposed to multiple courses of antibiotics. If they're exposed to antivirals or antifungals, no difference. So it is antibacterial action of the antibiotics. The more antibiotics they get, multiple courses they get, higher chance of developing juvenile rheumatoid arthritis, which can be pretty disabling. There's even a connection between the gut and the brain through microbiome. Just fascinating. So the immune system, our immune system is active in myelin destruction, which is a key component in diseases like multiple sclerosis. Alteration in gut flora in mice leads to a multiple sclerosis-like syndrome. It's called experimental autoimmune encephalomyelitis. And preliminary work suggests that the gut in MS patients contains bugs that drive inflammation and are low in the types of the bacteria that control inflammation. So multiple sclerosis, autism, obesity, rheumatoid arthritis, many things are being linked now with the microbiome. There was a very interesting thing that happened in a town called Walkertown, Ontario in Canada. In May 2000, heavy rains occurred. And then there was an epidemic of E. coli. Half the residents got ill and 7 individuals died. 2 years later, they asked the people in the small town, what has happened since the outbreak to you and symptoms? And they turned out that a lot of people had developed depression, anxiety, panic disorder, or post-traumatic stress syndromes. The ones who were exposed to E. coli had a greater chance of developing all these syndromes. So again, this is epidemiological, it doesn't prove it, but the gut microorganisms are capable of making neurotransmitters such as norepinephrine and serotonin. If you take mice and you feed them lactobacillus, it alters their swimming mobility. But if the vagus nerve is severed, the mice become hopeless again. So again, this is a gut, central nervous system through the vagus nerve mediated. If you take germ-free mice and restrain them, it leads to an exaggerated ACTH response. If you colonize them, these germ-free mice, with bacteria, it abolishes this response. So against the bacteria. Normal mice subjected to psychosocial stress, that changes the microbiome. They have a decrease in bacteroides, increase in Clostridia. In human beings, probiotics may modulate brain activity. So probiotics in America is a $31.5 billion industry. And there's very little proof that probiotics help. They help in pouchitis, they help in antibiotic-associated diarrhea. There's a wonderful paper from Chandigarh published in Gastroenterology where they took cirrhotics with hepatic encephalopathy, treated them with a probiotic, I think it's called VSL3. Huge difference. Improvement, Child-Pugh score came down. This is really remarkable. This will be much better than treating with lactulose or with rifaximin. So, microbes have this amazing influence. There's an animal model in a rat of lupus nephritis. They're having proteinuria, large amounts of proteinuria. You simply give them an antibiotic to the rat. Significant amelioration in proteinuria. We've all heard about cholesterol, C-reactive protein as risk factors for heart disease. There may be something much more important than cholesterol and CRP. So there is something called TMAO, right? So TMAO. So when an individual ingests meat or high fat foods, it is converted into TMA by the gut bacteria, by the microbiome. And TMA is converted in the liver to TMAO, trimethylamine oxide. There's a wonderful paper from Cleveland Clinic, and it shows that, published in the New England Journal of Medicine, that the TMAO levels correlate better. The TMAO levels correlate better as a risk factor for heart disease and stroke than cholesterol and C-reactive protein. So again, gut bacteria are the major players in increasing levels of TMAO. Artificial sweeteners. I've been telling all my patients for years and years and years, if you want to have a Coke, have a Coke. If you want to put sugar in your tea or coffee, put a little bit of sugar. Don't go for the artificial sweeteners. And now the science has caught up. Artificial sweeteners actually induce worse glucose intolerance. How do they do it? They alter the gut microbiome. Again, it's the gut microbiome. So this is a study in a transplanted culture, and you look at blood sugar, and you have a control animal and an animal that is given saccharin, and the one that is given saccharin, high levels of blood glucose. Okay, so avoid artificial sweeteners. Don't worry about the 120 calories from a can of Coke. Have 1/3, have 40 calories, get rid of the rest of it. But enjoy the Coke, don't have Diet Coke, don't have diet drinks. Gut microbiome and autism spectrum disorder. So pregnant mice injected with artificially created virus-like DNA, the offspring display less socialization, greater sense of being startled by sounds, fewer vocalizations. The serum of these mice contained more than 40 times the amount of a product called 4-EPS, which again is a metabolite of gut bacteria. Children with ASD, autism spectrum disorder, have high concentration of a similar compound, precresol, in their urine. And if you take healthy mice and inject them with this compound from the urine of patients with autism spectrum disorder, the mice develop a leaky gut and start displaying symptoms of autism spectrum disorder. Probiotic treatment with a particular Bacteroides fragilis in these autism spectrum disorder mice restores intestinal permeability, and those levels which were high return to normal. So let's define what are probiotics and prebiotics. Probiotics are selectively products that contain ingested microbiomes, microorganisms that are associated with health benefits. Prebiotics are selectively fermented products that confer changes in the composition and or activity of the GI tract microflora and are said to again confer health products. So, more than a century ago, Elie Metchnikoff, also a Nobel laureate, he said the dependence of the intestinal microbes on the food makes it possible to adopt measures to modify the flora in our bodies and to replace the harmful ones by good ones. So the right foods, the right prebiotic, probiotic, proper nutrition, not taking powerful medicines like proton pump inhibitors, which totally abolish gastric acid secretion, change the microbiome, will turn out to have very, very important therapeutic implications. We're all familiar with a disease called C. diff colitis, and 15 to 20% of patients don't get better. They have refractory, you treat them with multiple courses of antibiotics. They can develop fulminant C. diff colitis. They can have protein-losing enteropathy, to develop toxic megacolon, perforate, and die. Sometimes we do a total colectomy. Very simple treatment for these patients. You take stool from a patient or a spouse, you check it for HIV, hepatitis C, HBV, make sure it's fine, and then you give that stool to the patient, either through a nasogastric tube or colonoscopy. But somebody at Mass General Hospital, Harvard Medical School, came out with a very simple idea.
Capsules.
They took the stool, they tested it for HIV, HBV, HCV, tested it again a month later, they froze it in a capsule. Patient consumed it quickly. They had 20 patients, 14 had one treatment cured. The other 6 didn't improve, they were retreated, one more treatment, 4 out of the 6 responded. So 18 out of 20, 90% cure rate of a very, very bad disease. I call it the frozen poopsicle, not popsicle, but poopsicle. And now people will isolate the bacteria, and then you'll have a capsule with the bacteria without the stool. And that will be an amazing treatment. So, it's really pretty amazing what's happening. There, like you mentioned, there are annual conferences in microbiome, gastroenterology. The official journal of the American Gastroenterology Association came out with a special issue, the gut microbiome and health and disease. I think we've just seen the tip of the iceberg. I prefer another saying. It's an African proverb. It says, we have simply seen the head of the hippo. The hippo is this huge animal and it's swimming. You've just seen the head above the water. We've just seen the head of the hippo. So I think stay tuned. The microbiome is one of the hottest topics in medicine. I think if you want to develop a center in Delhi, an academic center, maybe with a lot of hospitals forming, maybe philanthropic or foundation support or the Indian Medical Association, and then get all the specialists in rheumatology, endocrine, nutrition, diabetes, GI, pulmonary, neurology, and do some wonderful clinical protocols. And I think it'll be dynamite, and we'll learn a lot about medicine, and we'll be able to cure a lot of diseases.
You have been able to identify specific
Bacteria.
bacteria for specific ailments and specific treatments.
Yeah, so this is what's going to happen.
Yeah.
I think in the future, you've heard of personalized medicine, precision medicine, right? Somebody has a cancer. One person's breast cancer is totally different from the other person's breast cancer. Even though under the microscope they look identical, right? Pathologist says. But each one has a unique molecular signature. And we're going to say this person, patient A, needs this treatment and patient B needs this treatment. I think in the future, maybe in the next 5-10 years, it'll be easy and inexpensive to study somebody's human microbiome. And then you say, for you, with this microbiome and with rheumatoid arthritis, you need to take probiotic A, B, and C in combination. And that will change your microbiome and ameliorate your rheumatoid arthritis. The next patient with rheumatoid arthritis will be different. It'll be precision medicine, it'll be precision probiotics. Right now it's hit and miss. I take a probiotic and I feel very good, my digestion is very good, I think I have more energy. I have no idea what I'm taking, what are the bacteria. So I go to a health store in Boston and I sometimes get 2 different probiotics and I take them. And a lot of my physician colleagues are doing the same. But in the future it'll be precision. Say, Sanjiv, you need to take this, KK. The one Sanjiv is taking will have no benefit for you. You need to take this one. Right? And then if he gets a course of antibiotics or he gets heartburn and takes PPI, it'll change. Then we'll need to study him again. But that I think is in the future.
And you want to give us an impression, not to us, to the audience
Yeah.
as well, that the whole concept of medicine, prevention, control, and treatment is going to change the next year, 3-6
I think it will, absolutely. I think Mediterranean diet also changes the microbiome, like vegetarian diet. So I have a book coming out next month and it's called The Big Five, and 5 things we can do to live longer based on scientific evidence. And the first one is coffee. Coffee lowers the risk of cirrhosis.
Which coffee?
Regular coffee.
No.
Doesn't matter what, just regular coffee.
Whether with sugar, without sugar?
Doesn't matter.
So whatever.
What I tell my black coffee, you want to add a little bit of milk, add a little bit of milk. Most important, don't put cream, don't put artificial sweeteners. So coffee lowers the risk of 5 cancers: primary liver cancer, metastatic prostate cancer, colon cancer, skin cancer, endometrial cancer. Coffee lowers the risk of Parkinsonism, cognitive decline, dementia, cirrhosis, type 2 diabetes. If you already have type 2 diabetes and drink 2 cups of coffee, and it can be regular or decaf, 60% reduction in cardiovascular mortality. Coffee has thousands of constituents: carviol, cafestrol, chlorogenic acid, it's insulin sensitizing. Anyway, first one is coffee. Second, we all know, is exercise, right? The best drug. The third is vitamin D3. You were telling me that 80-90% of Indians are vitamin D deficient, right? It's the only vitamin we should take. And we don't get enough sun exposure, and dark complexion, we absorb less ultraviolet radiation. We're finding young people playing soccer in Florida, where it's sunny, are vitamin D deficient. Why? The skin doctors have done a very good job with sunblock, right, to prevent skin cancer. So coffee, exercise, vitamin D. So on a good sunny day, don't put sunblock, go for a brisk walk to your favorite coffee shop. Now you got the vitamin D, the exercise, and the coffee. Don't go nuts remembering this. Nuts are very healthy. New England Journal of Medicine article: even if you're overweight and don't exercise, but eat a small amount of nuts, you live longer. New England Journal of Medicine. All the nuts. Pine nuts, cashew nuts, almonds, walnuts, even peanuts. Not macadamia, not coconut, rich in saturated fat. And the fifth thing is meditation. Meditation increases telomerase, which is related to cellular aging. Elizabeth Blackburn got the Nobel Prize in Medicine Physiology in 2009 for discovering telomeres and telomerase. So what I say is, on a nice sunny day, go for a brisk walk, don't put sunblock, go have your coffee, don't go nuts remembering this, eat a few nuts, and before you go, meditate. And there's an ancient saying, says you should meditate once a day, and if you don't have time to do that, you should meditate twice a day. Then you really need it. So the Buddha was asked, what did you gain from meditation? He said, I didn't gain anything. But let me tell you what I lost. I lost anxiety, anger, depression, fear of old age, fear of death. I lost all of that. So meditation is very powerful.
So let's go back to the concept of fecal transplant.
Yeah.
And that means fecal transplant is going to become a reality.
Yeah.
And what do they do? Is it, what are the different types of?
So I think right now,
If I convert microbiome into therapeutic microbiome.
Yeah, if you could take the bad microbiome and put it into the healthy microbiome, then it clearly helps in C. diff colitis. Now people are starting to study it in irritable bowel syndrome, ulcerative colitis, Crohn's disease. Those are the GI disorders, celiac sprue, all of these disorders. But we have to wait for the research.
No, as on today, for a healthy person, what should they do? I mean,
For a healthy person,
one is curd.
For a healthy person, we talked about coffee, exercise, vitamin D, nuts, meditation. In terms of diet, vegetarian diet is much better than animal diet, right? And then yogurt is very good, a lot of bacteria. If they still feel the stomach digestion is unsettled, try 1 or 2 different probiotics.
Okay, I'll say yogurt is also a probiotic.
Yeah, yeah.
So all yogurts are same or they are also different? Microbiome are different.
Totally different. No one has scientifically studied.
So therefore, I'm saying so that
there are thousands of questions just in diet and microbiome, and it can be easily studied. And no matter what the results are, they are publishable because it will have an impact on our understanding.
Suppose I want to take out curd. Suppose I want to check
Yeah.
up curd of say 30 states curd I bring.
Yeah,
All the 30 states. What do I test?
you test the microbiome. You study the stool before and after. Somebody's been on that diet for a while, right? So you can do that. Then you can say, what about cheese? What about lassi? All of it can be studied. What does mango achar do to the microbiome? We have no
I'll
idea.
I'll tell you
It's
one.
such a fertile area.
If I take probiotics,
Yeah,
take the capsule,
Yeah.
put it into milk, it
yeah,
will be converted into dahi.
yeah,
I've done it
yeah,
because
Sure, because the bacteria.
my sister brought some
yeah,
US probiotic
yeah,
and I've been using it as a dahi every day.
yeah. And do you feel better?
No, it's not. I'm telling you that you can also prepare your own probiotic, medicinal probiotic, by converting it into dahi, curd.
Yeah,
By using that as you put it into milk
yeah.
and
But the point is that if there are 10 people and they consume the same
results will
prepared
be different.
curd with probiotic added to it, it'll have a different effect.
So
likely
as on today,
the-
hit and trial.
Right now, it's hit and miss. It's hit and miss. In the future, there'll be precision.
So as on today, if I have any refractory disease,
Yeah,
I'm talking about
Sure.
any refractory disease,
yeah.
give him a trial of multiple probiotics.
Take at least 2 or 3 different ones because they have different bacteria.
Breakfast.
The one that talking to some experts in this field in America, that we recommend and recommend very loosely, telling our patients is not based on any scientific study, but there's one called Philips Health. Philips Health, and you buy it at a food store. They're not inexpensive. You know, you get 30 of them will cost like $45. So you take one a day, and you're not sure that's the right one for you. Then you take another one. So right now it's hit and miss. But if somebody has a chronic disabling disease, like bad rheumatoid arthritis or lupus or Crohn's, it's worth trying till the studies catch up.
Okay, so one is multiple probiotics.
Yeah.
Any link with food, before food, after food, or doesn't matter?
It's a good question. I don't know if it's been studied.
With coffee, without coffee, with no, you don't know.
I don't know.
So as on today, you can take up to three.
Yeah.
3 different varieties you can.
Yeah, I would take them before a meal or with a meal.
Take. Okay, that's one. 2. Stool of a newborn.
Yeah.
Say
It's sterile at birth.
at birth. So suppose I say.
But it also depends. So see, here's another interesting thing that people are doing. It's slowly catching up in America. They take permission from the mother. And a newborn is born by C-section. They take a gauze, put it on the vagina, so get the secretions, and then swab the baby. And they're now going to study to see if it makes a difference in the outcome. Okay? So kids born by C-section have a higher risk of
Mother's
developing
vagina?
type 2 diabetes, celiac
No,
sprue,
you're talking
asthma.
about mother's vagina.
Mother's vagina,
So that you are,
swab,
because you are missing in
some
C-section.
stool. You're missing it in C-section. You're not coming through the birth canal.
So therefore, that you are trying to. Give
You're
it the
trying to
state.
repopulate, and they've shown already that you study them a month later, their microbiome is the same as the microbiome of
As if
individuals
they would have
born by
No,
vaginal
I'm saying
delivery.
something. I'm saying 24 hours later.
Yeah,
If you take the stool
yeah,
of healthy newborn
yeah,
at 24 hours,
Yeah.
so his microbiome will be healthy,
yeah,
potentially healthy,
yeah.
and that use that as a broad spectrum for people who are terminally illness.
Possible. I don't know. I don't know the answer.
If you want to do a fecal transplant in
Yeah.
see in India, refractory conditions are rampant.
Yeah,
Because
sure.
and they move from here to here.
Yeah,
Kuch to kar do. That's the answer. Is they will not mind trying anything. So if some study has to be done, suppose we want to give them a healthy microbiome. What is the definition of a healthy microbiome?
again, it will depend on the individual. What is healthy for you may not be healthy for me. I keep harping on that. This is precision medicine. This is the same way as you will be treating cancer. We will be treating benign conditions, diabetes, arthritis, lupus, nephritis, flu, with precision. And we don't know whether a newborn at 1 month is better than, taking yogurt with two different probiotics.
So as on today, there is no breakthrough. These are all assumptions.
Yes.
And
this
assumptions
is-
are based on my studies.
No, some in humans.
Some in humans.
C. diff is humans.
See, C. difficile is now in India, we are
Yeah.
seeing in community acquired. It's no more
Yeah.
healthcare associated
Yeah,
because it has entered into the community.
sure.
And we are getting a lot of cases in the community with C. difficile.
C. diff. Yeah.
And
And the reason for that is antibiotics are used willy-nilly, not only in human beings. As physicians, we prescribe antibiotics for viral disorders, but also in the agriculture. So poultry, beef, pork, they are giving them tons of antibiotics in the food. Because one cow gets it, it spreads, and you have to slaughter all the cows, you have to slaughter all the pigs. So they use a ton of antibiotics. It's leading big time to antibiotic resistance. That's another huge problem we have now, medical. Okay, so stay tuned. I think I prepared this talk about a year
We
and a half
still
ago,
have
and
10
every 2 weeks I have to update it. There's a new study.
Now I think we can correlate with our mythological treatment. The cow urine and cow dung is being used for the treatment of various illnesses in the past. That
Yeah.
we can now
Yeah.
confirm into
Yeah.
the microbiome.
That's a wonderful point.
Microbiome.
But don't take the cow dung and put it on the umbilicus.
No, that is true.
Then we
are
get
not going to
neonatal
promote-
tetanus, right? We don't want tetanus. So that's why I have a slide. It says friend or foe. It can be your friend, it
What
can
about
be your
the
foe.
microbes that you have outside the intestine, for example, the skin?
Yeah, there's some on the skin, there in the ears, in the vagina, in the nasal cavity, but what's been studied best
On the
is the
cavity.
gut. Gut microbiome is the one that people have focused on, and now they start to study. There's also something very interesting called biological dark matter. So this is a new concept, and you're going to hear more about it in the future. But what is biological dark matter is, there's a wonderful TED talk by Nathan Wolfe, biologist and explorer, and he talks about biological dark matter. So it is uncharacterized genetic material that is found in humans, that is not part of the existing 3 domains of life: bacteria, archaea, and eukaryotes. It may well be a 4th domain of life. And it apparently accounts for 40 to 50% of the genetic material in the GI tract. 40 to 50%. 20% of the genetic material in the nose, and 1% of the genetic material in sterile blood. What is this biological dark matter? So we'll find out
Slightly,
in some
I'm
years.
going to take you back to Ayurveda.
Yeah.
In Ayurveda, we have the concept of Vata Pitta Kapha.
Of what?
Vata Pitta
Vata,
Kapha.
Pitta, Kapha. Yeah.
Then we have the concept of 7 dhatus.
Huh.
Okay. Now see the 7 dhatus: Rasa, Rakta,
Yeah.
Mamsa, Medha, Maja,
Yeah.
Asti, Shukra.
Huh.
One of the theory of Ayurveda is, when I eat food,
Yeah.
सबसे पहले, the first of all, rasa will be made.
Yeah.
Okay. Once the rasa, the whole need of rasa is over, then only rakta will be made.
Yeah.
Then
Right.
rasa, rakta, mamsa means muscle, medha means adipose tissue, majja is bone marrow, then bone, and then the last. Say for example, they says, if I have a disorder at the level of rasa, then rakta will not be made, mamsa will not be made, medha will not, so I will have proteome manifestation. So all disorders of plasma will have disorders of blood, anemia, mamsa,
Yeah.
myositis,
Right.
muscular dystrophies, bone marrow involvement, bone involvement, osteoporosis, and everything. Rasa, rakta, disorders of blood will have normal plasma, but they will have impaired other thing. Rasa, rakta, mamsa, disorders of muscle may not have anemia, may not have serum protein deficiency. Okay? Rasa, mamsa, medha. Medha is adipose tissue. Disorders of adipose tissue will have normal muscle. So that's how the whole theory
Right.
comes into it. Now this says the formation of that requires, there are 3 basic things they describe is vata, that is prana, and then agni, and then oja. Oja in our scientific language we don't understand.
Yeah.
Tejasvi bhava, ojasvi bhava. So we don't understand oja in allopathic medicine, but the nearest will be immunity, our immune cells and everything. Agni we don't understand, but it will be metabolism. The nearest will be.
Right.
Now they say there are 13 agnis,
Huh.
13 types of agnis. One of them, these are called jathar agnis. That for the first one is pachak agni, which digests, which is present in the duodenum. Then they take, there are 12 more agnis, 7 dhatus, and 5 for the air, fire, water, earth, 5 basic elements. So these 12 agnis in the body, I have no equivalent in modern medicine today. And each one of them require a different food, each one of them require a different treatment. They can be Magni Agni, Tikshna Agni, Neutral Agni, and Hypo Agni. There are 4 different types of, they can be impaired, they can be higher, they can be low, Mand Agni, which is Kapha disorder. Tikshna is a Pitta disorder. Disorder is a Vata disorder, or they can be normal, Samagni. So there are 4 different situations. The only answer today is to sit with Ayurvedic doctors, the scholars, and trace out that these 12 different types of agnis are 12 different types of your microbiomes present in the body.
Yeah, it could very well be.
And their harmony.
It's the Agni of the microbiome and the human being
So therefore, there has
having
to
a
be
dance.
having a dance.
This
There has to be
evolutionary dance
12
that has
different
occurred
types
for
of
millions of years, and
12 different classifications.
crosstalk is occurring and it's still going on. Nobody's shut up. We have to listen and we have to figure it
12
out.
different types
There's
of.
a saying, diet is destiny,
Absolutely.
right? Diet will affect everything in our physiology, but a lot of it is through the microbiome.
If that's so, then there has to be in every individual
Yeah.
12 different types of microbiome present. disorder of any one of them will cause a particular disease.
Yeah. If a certain species is predominant and the other species are down, it will alter your susceptibility, proclivity for a particular disease.
Because they basically, when they talk about is,
Yeah,
they don't talk
fascinating.
about symptoms, they don't talk about science, they only
Yeah.
say we change the environment to treat.
Yeah.
That environment has to be bring back that microbiome back and the whole disease becomes all right. Say
Sure.
for example, if they treat rasa, then all
Yeah.
plasma disorder, irrespective of which disease it is, will
Yeah.
get cured. That's what the
Yeah.
concept of
I
Ayurveda
think
is.
it's much more comprehensive, it's much more well thought of, it probably has much more wisdom. It was probably cognized by the sages without any scientific instruments and any of that, right?
Explanation, but they
Huh?
knew everything.
They knew everything. Yeah, they just
were-
cognized
They were
it.
in a position to explain you that this is the problem and it can be treated like
Yeah,
this.
yeah. Amazing.
I mean, otherwise, there's no concept why one should take
I know.
cow urine.
Yeah.
You know, there's some microbiomes
Yeah.
which is coming from there.
So the
and-
microbiomes are in the GI, skin,
Everywhere. Body surfaces and all the cavities, nose,
All
vagina, ears.
bladder will not have,
Huh?
bladder will not have.
Probably not. But you know, urine contains other things. Urine contains urokinase.
So many things.
You
So
can
many-
dissolve clots. You know, Muraji Desai drank urine.
Rajikula. I mean, that's what medically we used to laugh at.
Yeah, but we don't know. Again, it should be studied. If somebody is willing to study it, if patients are willing to drink urine, saying you'll either drink urine or something that looks like urine, and we study you.
You may find
Randomized.
many people are drinking.
Oh,
instead
they are
of
not.
drinking.
I know people in India who drink it, who actually look very healthy. They don't talk about it because
they'll not
most
talk
people
about it.
will
People
say,
will
"What are you
laugh.
doing?"
They'll laugh at
They
you.
laugh at them. Yeah,
That's
yeah,
and as per for Ayurveda, everybody is laughing that it is not a science,
yeah.
it is not a medicine. But
Okay,
it is-
let's time to close.
Yeah.
5 minutes on leadership.
5
for
minutes
our-
of leadership.
What our doctors should know about five or 10 principles of leadership. One you said was yesterday.
So I think everyone can lead, and you can lead in many different ways. You don't need a title to be a leader. You can have a title of a leader like CEO, president, dean, and not be a leader. So what are the basic tenets of leadership? I wrote a book on this. It's called Leadership by Example, the 10 Key Principles of All Great Leaders. And I have a mnemonic and it spells out leadership. LEADERSHIP. L is listen, be good listeners, right? Oliver Wendell Holmes said, it is of the province of knowledge to speak. It is in the privilege of wisdom to listen. So let's be better listeners. Number 2, E is empathy. Be kind, be compassionate. The Dalai Lama once said, be kind whenever possible. It is always possible. So E is empathy. A is an attitude that is upbeat and courageous. The most successful people on this planet have what's called grit. Grit is having passion and perseverance for a long-term articulated goal. So LEAD is leadership. So LEAD is having drive. Again, similar to having courage. E is having a lot of effort, having enthusiasm, having energy. R is resilience. S is having a sense of purpose. H is having humility. Great leaders have humility. Albert Einstein, Albert Schweitzer, when he got the Nobel Peace Prize in 1952, he said, now I have to go earn it. Talk about humility. H is also humor. I is integrity. You can do something good for years and years and years, decades, and then you compromise your integrity and your reputation is gone. And P is packing other people's parachutes, which is a metaphor for mentoring and nurturing. Each one of us is here today because somebody helped us, right? Somebody packed our parachute. Could have been a teacher, a principal, a parent, an associate, an aunt, sibling. And your job is, our job as leaders, is to pack other people's parachute. And also thank the people who packed our parachute. So, and my plea is don't wait for the eulogy. Don't wait till they die and then at the cremation you get up and give a speech. This person was great, help me. Do it now. Go meet with them. Write them a letter. So those are the 10 key principles of all
What are the
great
5
leaders.
regrets I should not have at the time of death?
D is actually dare to dream big. Okay, so great leaders dare to dream big. And having a sense of purpose, I think Mark Twain said it the best. He said the 2 most important days in your life are the day you're born and the day you find out why. What was your purpose in life? So each one of us has a purpose in life. It'll come to you by reflecting on it, or you'll witness something really bad and you'll say, you know what, I'm going to make a difference here.
And
So-
what are the 5 regrets a leader is not supposed to have?
So
at the time of death?
no, so this is 5 things that people say. They say, I should have traveled more. I should have said I love you more often. I should have been the bigger person and said I'm sorry. I should have had the courage to pursue my dreams and aspirations. I should have said, spent more time with my friends. Who says these 5 things? There are people who are facing imminent death. They're going to die in the next 6 months. These are their greatest regrets. Nobody says, I should have worked harder. Nobody says, I should have made more money. Nobody says, I should have driven a Ferrari or lived in a huge mansion. So the point of all of this is, we should now be doing these things. All right? Travel. Say, I love you. To your friends, hug them, say, I love you. Be the bigger person and say, I'm sorry. Never ruin an apology with an excuse. Harry Truman. Never ruin an apology with an excuse. Say, I'm sorry. If you come late for a meeting, I'm sorry. Not, there was an accident, there was traffic in Delhi. No, don't ruin it. So, I love you. Spend more time with your friends. Travel. Be the bigger person, say, I'm sorry. And have the courage to pursue your dreams and aspirations. And we should be doing that now, not on our deathbed, saying, should have done that, right? Those are the regrets of people.
So what we have done today is not only we have talked about microbiome, which is going to be the future. I think at IMA level, we should do a conference or a discussion where we involve people and try to see whether IMA can take a lead, because this is a multi-speciality subject. Let's see whether we can take a lead in the subject of microbiome and health. And we also talked about leadership. We have a true leader sitting in front of us, and IMA is compiling 100 top influential doctors in the country who have made a difference. And we know Sanjiv is going to be one of them. That's all for today. We'll come back next week with one more subject. Till that, goodbye. I say thanks to Sanjiv.
Thank you, KK.
And
Great
thanks
to be here. Great
Dr.
to meet
Tandon,
you.
and thanks Dr.
Thank you,
Monga.
sir.
We'll be back next
Thank
week
you,
with
everyone.
another subject. Thank you.
Good job.